how about an update from the West Bloomfield Fire Department, Chief?
Sure. And I did want to wear my mask today because even though I'm by myself for the interview, it's important to just start recognizing that this is what we're asking people to do. And clearly, if I'm not, modeling that behavior and doing that as the fire chief within the community, it seems like it's a kind of a big ask of everybody else. So I'm getting more and more comfortable in wearing my mask. I wear it around in the office. If I'm working closely with a colleague, then I wear it. And I'm encouraging people that are at home right now and they're not back to work yet to start wearing a face covering. Get used to it. You'll see my glasses fog up a little bit now and then. Every so often you got to readjust that, but we've got to figure this out because this is going to be a big component of stopping that community spread that we're all so worried about.
Well, and in the spirit of masking up, we've been doing the same here at the studio. It just did get in the way of the broadcast, but we have our masks. They're right here. And the minute we get off the air, we put our masks on immediately. Tyler and I do a really good job of keeping our social distancing. But this is the new normal. And you know what, Chief? I appreciate you doing this today because we don't know. As I said in the open of the show, we have no idea where this is heading. It's very possible. Some experts say we're going to get another spike after we start opening up. Other people say, no, it's not going to happen. Nobody knows. You don't know, and you know as much about all this as anybody, right?
Well, what we do know is that we've been doing a great job, Dave. And we have so many folks that I think we're starting to focus too much. The critics are getting a little bit too much airtime. I hear folks talk about, I saw a family walk by and they weren't social distancing. And Byron, the fire marshal, and I were out here talking just before the interview, and small family walks by, a little boy riding his bike with his helmet on. Mom has a stroller with a baby. And, last year this time, we would have put the bay doors open and we would have invited that family right in here. Things are just a little bit different, but that family was out enjoying the day, and the critics might say they were too close, but quite frankly, they cohabitate. They're comfortable with each other. They're only out because they're all feeling well. None of these mitigation factors are independent. It's not just social distancing. It's not just hand washing. It's not just face coverings. It's all of those things together, Dave. And people need to keep all of that into context, because that's what's gotten us to this point, and with the numbers being getting a little bit flatter, and that's what's going to continue to mitigate the spread until we can get a vaccine.
Right, and we're making progress on all the medical fronts too. In addition to the work on the vaccine, in addition to the work on various treatments, which we're seeing more and more. Just our medical professionals and your EMS people, I'm sure, are seeing this as well. Our medical professionals have better capabilities and a better understanding of how to treat patients and how to handle patients and all that. Every day we deal with this, we gain experience. I'm sure you're seeing that, and you're probably experiencing some of that in the way that your EMS people treat people as well.
Oh, they are. The quickness that they're able to respond now with putting on their PPE, the comfort level now with our friends in the extended care facilities, our long-term care facilities, and their positioning of patients and having them ready to go for us, our 911 operators that are screening the calls. I mean, everybody is finding the most efficient way that we can help to mitigate the spread, but also to manage those that are sick, because that's what we're here for. We're going to take good care of people that have fallen ill to COVID-19, and we're able to do that. We're able to provide care. Look at the numbers of people that have recovered from this disease, Dave. They're outstanding. And I know that there are numbers that are scaring us, because they're the death, the toll that this disease has taken on our community, our state, the country, and the globe. But the mitigation factors have kept that number down. And it's clear that the number will continue to go up, Dave. We know people are going to continue to unfortunately die until we can get a vaccine. So, it's finding some balance with all these experts. I was watching the news this morning, and they just said, well, the death toll is going to continue to grow. Well, I think that's a bit intuitive. I think we might be sensationalizing some of that. There is no vaccine. and there's no way to completely eradicate the virus yet. So it only makes sense that we are, unfortunately, and this isn't easy to say, that we will continue to lose people. And so that's why the wearing a face covering, as uncomfortable as it may be, and as fogging glasses can be annoying, we've got to do it. And we've got to get back to work too. So
it's almost Greg Flynn. It's
one or the other.
Greg Flynn, fire chief in West Bloomfield. It's almost gone the other way. Now you can almost become ostracized if you're out in a grocery store or out about town and you're not wearing a mask. I mean, nobody was before. Now that everybody else is doing it, you can look a little silly and feel a little irresponsible if you're not doing it. And look, it doesn't hurt. It's I wear these bandanas. That's what I do. For me, it's kind of a style thing, and it's my own style statement.
Right.
I embrace the fun of it. And a lot of other people have done the same thing. We've seen a lot of creativity with custom masks and custom designs, and just embrace it, go with it. My goodness, we are so much better off because we are out and about and we are working. And, this is an all hands on deck situation. You know what I say? And by the way, I appreciate your optimism, Greg Flynn, and everything you're saying today. But, this is our country at its best. If this is the opportunity for every person to show true patriotism and really, it goes back to that Kennedy thing, ask not what, right? So this is where you get a chance to do what's good for the country by doing the things that you need to do yourself, right?
Right. It is. And when we look at what you're hearing is the crews are going out right now, which is good. It's good for your viewers to see that their firefighters are in action here.
All right, tell us, just as long as we've had the interruption, what are you hearing and what's going on, or is that something you can't share with us? Or?
Oh, no. So right now, one of the things that we do is in caring for the community and meeting the community with all the needs that they can have is often some of our folks that live within the community will fall or get into a position where they're not able to get up. They need some assistance. And so we'll do what's a non-emergency response to the residents, and the firefighters will go in and help them get back up, get them repositioned, get them to where they need to be. That's what we do. Remember and here comes another call. This is up in Station 3's area. That's for an automobile accident. So as all of these come in, all of that's coordinated through our dispatch center, and whatever that need is, emergent, non-emergent, we're ready to go. That's what we do, and that's what we've been doing since the start of the pandemic. There has been zero stop in our ability to deliver service. And not only have we been delivering the service we've always provided, the fire department's been delivering more service. The fire department's been responsible for the decontamination of township vehicles within West Bloomfield. The fire department continues to expand what services we've provided. We've started doing the blood draws for the police department to prevent them from having to go into the hospital arena for folks that need their blood alcohol level checked. So we've expanded service during a time when so many people are contracting services. And that's one of the things that I'm so proud of this team here at the WBFD, that they have, when everyone is in crisis and scared, concerned with doing more, your West Bloomfield Township firefighter paramedics have stepped into the crisis and are ready to go. And we haven't missed a beat, Dave. All along the way, I couldn't be more proud of all the men and women here.
Well, and we thank you so much for your service and all that you're doing. And we know it's complicated and it's hard work. And then you take all the things that you just mentioned that you're doing and the calls that are happening right now while we're live with you on the Megacast. And then you just in the back of your head, you got to be thinking, well, and on top of all that, I could get this thing if I'm not careful. So, your folks are on the front line, and believe me, we appreciate every single one of them. Can you talk, Greg Flynn from West Bloomfield? I know you're on calls with all the other fire departments around Oakland County and our service area here for the Megacast. Can you just talk a little bit about the conversations you're having with other fire departments? I assume all the things you're doing in West Bloomfield are happening in every other community in the area as well.
They are, and I know you've talked with some of our Oakway partners, and the Oakway is our mutual aid group, where all those departments that get together. And They are doing well. The things that we talk about are best practices that we're doing here. For example, some of our decontamination procedures we got from Chief Morin and his team in Bloomfield Township. We started doing testing in our extended care facilities, partnering with Oakland County Health. We had 4 of our paramedics in one of the long-term care facilities, the senior apartments, and our paramedics were doing the COVID testing. Dave, these are things that we haven't seen in our region from EMS providers. To the best of my 25 years in EMS, never seen before. And again, your West Bloomfield firefighters stepped into the challenge. And we're seeing that in Farmington Hills. We're seeing it in Southfield. We're seeing it in Birmingham. I guess I'm sounding a little bit boastful, but it's just what firefighters and paramedics and all of our colleagues in EMS, it's what they do in this time of a medical crisis, in time of a pandemic. We're mobile and we have the PPE and we're able to go wherever the need is. And then we work with our partners at the hospital when we deliver them via the rescue, via the ambulance, and then they get their more definitive care there. So it really is an all hazards response approach that we take at the FD.
Well, Greg Flynn, I appreciate you taking time, and it's fantastic that through the technology that we have, we're able to chat with you right in front of one of your fire trucks, right in the fire station as the calls are coming in, and you can be boastful all day on this show because we are very proud of what you're doing, and it's important that that message be told. And this is what this show is really all about. We're trying to get down to the grassroots level of finding out exactly what's happening in these communities that we serve, and you don't see this on the news. And we're not just here painting a positive story every day. We've told some brutal truths over the past month or so, but you don't see this. We don't hear that story that you're telling right now on the news. They can't take the time to do it. So that's why it's really nice that you take the time for the show and that you're sharing everything that's going on. A couple of quick questions back to you, Greg. So
Sure.
We're starting to come out. Greg Flynn, by the way, fire chief in West Bloomfield Township. So things are getting better. We're seeing the numbers improve. Things are getting better. I'm seeing more people out. It was actually kind of funny over the weekend. I noticed, and I would love your feedback on this, I noticed a lot more activity on the weekend, especially this past weekend, than during the week, because people are working during the weekend. A lot of them are working at home still. But on the weekend, we're getting out. We're going to the parks. Are you seeing your calls go up, and are you seeing more activity over the weekend? And are there any other observations that you're seeing as we're transitioning from the early days of this to where we are right now?
So great question, Dave. We have seen our call volumes return to normal. So our call volume, I would not classify as down, but we've left that peak where we had the huge influx of COVID that was hitting some of our senior living and extended care facilities a little harder. And so that surge over those first 3 to 4 weeks, that has started to subside. And we're also starting to see some of our calls for service that kind of went away. Surprisingly, heart attacks didn't stop, but we were seeing fewer and fewer people calling with those symptoms. I think, and it's nothing scientific here, Dave, it's just decades of experience speaking here, that the message was, don't go to the hospital unless you're dying. And we want to get away from that message. The hospitals, Henry Ford, our friends at Henry Ford Hospital have done a fantastic job. If you were to go over there and see what they have in place, they are taking great care to make sure that those that are coming in with non-COVID symptoms are routed in one direction, and those that are COVID symptomatic go in another direction. And so they're separating and preventing that community spread. They're experts in this, and we need to trust in the system here locally. And I'm speaking as an advocate for that. I trust them with our paramedics and testing for them and our paramedic firefighters. So it works. And I want to encourage people, if you're experiencing those signs and symptoms, to follow up with your primary care physician, or if it's an emergent situation, to use the 911 system, and we will take good care of you and make sure you get routed to the appropriate medical facility for your for your needs. So
well, and this is just
flat.
all of this maturing too, Greg. I mean, we've got a month and a half or so into it now. You just can't turn this on in one day. They needed to figure out how to do things over at the hospital. You needed to figure out how to do things. We have more testing capability now. We're talking to doctors here in the greater West Bloomfield and Oakland County area that are doing testing in their office now. We have more testing sites, so we have better procedures. I talked to somebody that went over to an area hospital over the weekend, and they got right in and were tested immediately, and they weren't waiting in a long drive-through lines. All of this is getting better, and that's part of the reason that we're in a position now where hopefully we can begin to open things up a little bit more in the community. You and I sat down at the very beginning of this across the table with a bunch of other folks in West Bloomfield to talk about how we were going to deal with this. I think you've done a great job. Township's done a great job. Other people, police department, the community has done a great job. Now we're getting ready to enter into a new phase. Buildings are going to begin to open up. We likely sometime in the month of May, if everything continues well, businesses are going to start to open up. Manufacturing could be starting in the month of May. Township offices, city offices around our area are going to start to open up. Do we need a whole other level of planning to get ready for this new normal?
I think the planning's been taking place. We've prepped the team, this great team of the West Bloomfield community, the greater West Bloomfield community, the Megacast broadcast community. They know what they need to do. They need to now muster up that courage to follow through, not just with going outside, not with re-engaging with people, but finding that social courage to wear a mask in public without it being some kind of negative symbol, that take pride in it, that you're doing your part to stop the community spread, to say hello to a coworker and welcome them back when you know that they're concerned, that they have someone that is at risk at home and they're afraid of bringing that home. Giving someone a virtual high five because they just sanitized their hands, or while you're in the, larger bathroom or something, somebody's washing their hands and they did it for 20 seconds under warm water and then dried their hands off. They're doing what's right, and we need to recognize that, not stigmatize the fact that someone, they're wearing a mask, or they have extra sanitizer. These are the things we should be celebrating, Dave. And what I feel is we're trying to focus on the small amount of people that maybe are struggling with this. I don't think that it's anybody doesn't want to do it. Some of this stuff is hard. Some of this stuff is very difficult, that if for decades you've never had to do this, and I said this to a group of folks the other day, show me a cause that globally has been taken on and gotten this much compliance that has ever happened. Show me how millions of people have gotten on board with doing these best practices. Celebrate that success. And let's not dwell on the handful of people that wanted to go to the beach because they haven't been there in 7 or 8 weeks, and that's what they like to do. And for a few minutes, they got to jump around in the ocean, and maybe they got within 6 feet of each other. I just think that that's not healthy for us to be dwelling on. We need to dwell on what we are being successful at. So I guess that would be the takeaway message here, is let's not really start getting upset because we saw somebody out walking their dog with 2 or 3 people near each other. I get it, 6 feet apart. I'm not going against that, Dave, but we can't have people getting upset and physically engaging with people because they are frustrated by how they're coping with COVID-19.
No, it's not a good idea. If you see somebody that's not doing the right thing, there are ways to get that message to them in a real positive way. I was so happy the other day. I was driving down the road on my bike, and I saw this I've seen so many really cool, just handmade signs along the road with positive messages, like the positive message you're sending out today. My favorite one of the last week was somebody just put the quote up of that Bobby McFerrin song. It just said, right at the end of their driveway, "Don't worry, be happy." I like that. So we need a little bit of don't worry, be happy. Greg Flynn, thank you for your positive message today. People need to chill out, and people need to do this. And I agree with you. It's cool to wear a mask right now. It's cool to be part of making this happen and helping out our country. Thank you for everything. Any final words from the West Bloomfield Fire Department?
Yeah, I would just encourage people to start practicing with their mask at home. I had a conversation with my teenage boys last night as my older son, he's a senior this year. Congratulations to Kellen. This is his last week of school, last week of Zooming, last week as a senior. But I asked him, I said, when are you going to wear a mask with your buddies? And he's like, well, I haven't thought about that. I'm like, no, we need to think about it. What mask are you going to wear? Are you going to make a mask? Let's not wait till the last second when someone's going out. And I asked them, you know, if you're going to go to the movies again, you're going to wear your mask. You're going to sit further apart from your friends. Start having those conversations with your kids now. They're anxious to get back with their friends. Set them up to be successful. Set them up to do it well and to do it right and to be a model and to have that conversation about the courage that they're going to need to make a good decision when they're around all of their friends and there aren't any adults around, quote unquote adults around, that they're going to make good, safe decisions in response to COVID-19.
All right, folks, you just heard it from Greg Flynn, the fire chief in West Bloomfield. He said, parents, it's time to have that conversation with your kids. Oh, it's only about a mask. It'll be okay. See, it could be a lot more complicated right now, right? All we got to do is have a mask conversation. Greg, thank you very much for joining us.
Cheers, Dave.
All right, to you as well. He is Greg Flynn, our fire chief.